Hey guys, once again, thanks for being here. Today, what I'm going to chat with you guys is top 6 most common injuries in the nursing profession. This is going to be a 3-part series. I'm going to first talk about, like I just said, about common injuries occurred in the nursing profession. Tomorrow, I'm going to talk about how to avoid any injury as you're working in the nursing profession, and then if you are injured, what you're supposed to do about it. So I'm going to do a 3-part series, and it starts today. So if you guys don't know who I am, my name is Jason Rozinka, and I am a nurse. I've been a nurse for the past 20 plus years, and it's all in direct patient care. So I know what injuries are like. I know how they can happen. I've seen patients over the years getting sicker, they're getting older, and they're getting bigger. And we're getting injured more and more, even with assist lift devices, different things that they're training us to do. It's still there. There's no real safe way to lift a patient. So injuries can occur. I've seen a lot of my coworkers go down and with career-ending injuries, and it's sad to see, but it's part of what our profession is like that a lot of people don't know about. So right now I'm going to go through the top 6 most common injuries in the nursing profession. Number 1 is probably the most obvious, but it's musculoskeletal, and we're talking about wrist injuries. We're talking about back injuries, ankle sprains and strains are the big ones. Shoulders. We're lifting heavy patients, and we're lifting them awkwardly a lot of times, and we're just prone to injury. There's a lot of injuries that can occur, and those are the big ones. We're 48% more likely to have these injuries than any other profession. Another one is needle sticks and sharp injuries. Now, those injuries have gone down quite a bit now that we don't use needles as often. When I first started my career, we used needles for everything. Then we went to blunt tip needles, and now we're just strictly needleless. But if you're looking at in procedural areas, there's no way around it. You're going to use needles, you're going to use scalpels, you're going to use all kinds of equipment that increase the risk for needle sticks and sharp sticks. Number 3, hazardous drug exposure. Certain aspects of nursing have more exposure to that. We're talking about chemotherapy. We're talking about inhaled anesthetics, stuff like that we're exposed to and need to be aware of that. Number 4 is hazardous chemicals. We're working in a hospital. There's all kinds of chemicals in the hospital. If we're talking about cleaning products, if we're talking about phosphorus, chlorine, formaldehyde, whatever they're using to clean in the hospital or in your whatever setting you're in, we're exposed to those every day. Number 5 is a newer one for me. I just recently became an interventional radiology nurse, and it's radiation. Radiation is all over the hospital also. They're doing portable x-rays, portable CTs now. So the exposure is there to radiation. And up until my training now with this last year, we really had no training in radiation exposure. Now, we do have radiation safety training, what I'm doing now, but it's not usually done throughout the hospital because we're not exposed that much. But over time, if you're not in the right place at the right time, you're getting more exposed to radiation, and that's another big one. You can't see it, you can't smell it, but it's there. Number 6, infectious disease. Now, this goes along with needle sticks also. You've got risk for infectious disease through needle sticks. Patient contact, anytime you touch a patient, you're at risk for transmission of infectious disease. We have a lot of people in isolation at MRSA, VRE, or whatever they're in, and we're at risk, especially airborne risk too, that you don't necessarily know right away. I mean, we've all taken care of that patient over a weekend, and you come in on Monday and they're in isolation, just like all of a sudden they have some infectious disease that they didn't have the whole weekend that you're exposed to. So it's there, it's real. Like I said, these are the 5 most common that I came up with and that I've noticed in my career. And tomorrow I'm going to talk about how to avoid any injury with exposure to any of these common injuries. All right, guys? Hopefully this helped. If you like this video, like, comment, share, and I'll see you next time. Play hard and eat well, guys.